So let me congratulate those who have submitted. It was very good one, very good information. I appreciate. Let me have your experience into it. By making it, what do you feel? How many of you were knowing? I think because earlier when we had a conversation at that time, many were said that they do not know about REM and REM sleep and EEG patterns and what is the importance of sleep. What I remember is, isn't it? After going through this assignment, what do you feel? Uh, it has improved, your knowledge about sleep has improved?
Yes, sir.
Very good. So this is what actually I expected. What uh, what I felt is this is many time I experience is that though we discuss it that we will go for this topic, but the basics are not done. And if these are not done, then many times either you may feel bored or sometime because we have to go fast, we cannot go for these basics. So if you want to enjoy actually the topic well, to understand it well, it is always good to go through these topics beforehand. I am very happy, really good information you people have put in. I appreciate it. Those who have not put it, maybe they are sleeping. I feel at least they are practicing it instead of putting on paper as a knowledge. And maybe even they are trying to sleep over this time. Many of them may not be even attending this class. I can see few are there. Anyway, fine. So I think it has clarified you about various things. Then if you go, if you understand what sleep is, then you understand what hypnotic sedatives are, because when we say that hypnotics are the drugs, they resembles. I told this definition yesterday. In earlier lecture I corrected it. Hypnotics are the drugs which are resembling to the natural sleep. That means the whatsoever EEG patterns are there, or what we call it as the cycles of REM and NREM, it will be similar in these drugs, or this drug will able to make it similar way. We have seen then you people have put in good information. I'll try. Yesterday only I received some WhatsApp message in Marathi related to sleep, why it is important. But anyway, you people have put in nicely. I'll try, if it is there, I'll try to pass it on. But why sleep is important, what is sleep is doing, very nicely people have put in. What I wanted to tell, one more important thing is, those who have made it in soft copy format, Word, Excel, Word or PDF format, I hope it is not just rapidly copied down. I hope okay. Presentation, can you connection has lost in between, and now again it has restored. Can you hear me? And
Yes, sir.
it is visible, fine. Okay, so
Presentation is visible, sir.
is not visible. Okay, this happens many times. It is showing to me that presentation is there. It asked me to stop presenting, but I'll stop it and I'll put it again. Okay, fine. So this is how. Now we have seen that what is the problem, what is the reason. Again it has lost. Okay. It seems there is some problem. This is happening. Anyway, I will try to cope it up. I am happy you people have really done it exhaustive. What I wanted to tell you is, those who have done it in by handwriting, it's good. I appreciate it. It's really good because it gives you ease in remembering it. In earlier days, people were telling, 100 times you read and 1 time you write, then that makes that equal reinforcement of the knowledge is there. So those who have prepared it in Word format or PDF format, I expect they have read it. Very nice one. Some people have went up to even more than 20-25 pages like that. So that is really appreciable. Very good information they have covered. But I hope they read it and they try to remember it, because whenever it comes in utilization of because it was the base of knowledge. We are not covering what kind of sleep is there, why sleep is important. We are not covering in therapeutics. We want to go ahead of it, because now we are going for a problem. There is a problem that people are not sleeping, or there is a less sleeping. Now we have to categorize it. What is happening into it? What are various steps we have seen, that is from the beginning to the end. We have seen various cycle stages wise. So this cycle wise, where it is going wrong, and then what we have to do in that case. So our job is next to it. It is actually based on the knowledge which you have acquired, or it is expected that you have acquired, and same is the case with the pharmacology. So very good. I again appreciate the way you people have prepared. Those who are not prepared, I'll suggest them to at least read what other people have made for you. Fortunately, it is a ready-made and open document available on WhatsApp, and they can enjoy their good sleep again as usual. So nice one. Let us go for that. What it is? So it is. It can occur to any kind of person of all ages. It seems there is some problem, but anyway, we'll continue. So it can occur to any ages, any type of races, and it has been observed all cultures and countries. It varies according to the situation, because definition of insomnia, if we modify, there are changes in that, and accordingly we can have 33% to 50% of the adult population may have insomnia. It with the symptoms can be distress or impairment. We call it as a general insomnia disorder in 10% to 15%, specific insomnia in around 5 to 10%, and consisting risk factors for insomnia like increase in the age, female sex, then comorbid problems like medical problems, psychiatric problem, any other concomitant comorbidities which can disturb sleep, or stress related things, substance uses like amphetamine. Like have you gone through amphetamine earlier somewhere?
Yes, sir.
Okay, can anybody tell me amphetamine uses, or its class? What's your anybody knows about amphetamine can either speak out or write. What's your compatible? Very good. It is CNS stimulant. Fine. Basically, which class of drug? Or what is mechanism through which receptors it acts? Pratima, correct. Anybody knows its uses? Yes, basically it is sympathomimetic. Very good, Mansi. Uses?
So this drug is called as super drug
Hmm.
or Superman's drug. For it stimulates the brain.
Hmm.
Use it as illicit use for
Yes, narcolepsy is therapeutic use. Huh, Mansi?
yes, sir.
What is use? What kind of use you told? Anyway, uh, yes. Anyway, basically it. Ha, yes,
Use
yes. Gayatri has put used by student for what purpose?
the CNS stimulation for euphoria, so
Euphoria.
that they feel
Yes,
euphoria.
yes, yes. Fine. Gayatri has wrote it is used by student for what? Gayatri, for what it is used by students? It's interesting.
So that they before an exam they can study all night and you don't feel sleepy and
Fine, fine,
basically your brain's activity is heightened.
fine, fine, fine. Okay. Anybody of you has tried?
No, sir.
Okay. Why not? If it has got so many uses, it can increase score by so many, you know, so many times, multiple times. You don't want to improve scores? See,
Not by artificial means.
it is not used actually, Gayatri. We call it as a abuse. Okay, when somebody knows that it can keep you awake, if it is used, you know what are the consequences. Actually, our teacher told a story when we were students. That means this may be hypothetical, but what can be the repercussion? Yes, it can keep awake. It is used as a abuse drug, as Mansi has told. That is, it is not used drug. It is abuse drug or illicit use, as she has used word. And you say that it can be used by students, so it is not authorized. It is again abuse. It is again illicit use. And if you say that it is used before examination to keep awake, yes, student can use it for two purposes. As Mansi has told, as a party drug to party whole night. Those who are interested can do in that way. And those who are studious, no, we cannot call them studious, because if they want any drug to study whole night before examination, that means earlier they were not studying, isn't it? And therefore they need some help so that they can remain awake whole night and they will study. If they have studied it earlier, then revision will not be a problem. This is what our teacher told us, which we tried to follow. But suppose amphetamine somebody takes, our teacher were told, they were telling us a story that there was a student and who took amphetamine whole night. He did not sleep and he studied very hard. Second day appeared for examination, very good examination, and he could do it very good, but the marks were not good. Why? Because a teacher like me understood that he has taken amphetamine and and deliberately did not give mark. Is it so, or some other reason maybe? The reason was, whatsoever written thing, he even went for this rechecking, reevaluation, something like that, and it was observed that whatsoever he has written, there was no meaningful sentence was there. Maybe he was knowing things, but he could not put it on paper in correct way. So this is what problem happens with insomnia. If sleep is not proper, if sleep is not correct, then whatsoever things are there, your mind may not, or your this association memory, as I told you earlier, this is association memory, that what questions are asked, it goes to your brain and it comes back. So that is not working. So this is what substance abuses are there. So there are many such substance abuse. So this, as I was telling, I don't know where we missed, because again this happened, that it was lost connect. Today I don't know what problem is there. It is repeatedly happening, despite it is on college internet, that is wired internet, we can say. Anyway, so whatsoever answers the student has written, there was no meaningful outcome one can make out, and that's why teacher could not give good marks. It was very less mark, or almost 0 mark. So this is what the amphetamine can do. I hope, if I think there was one movie, I do not remember names, you can search it out. Long back it was there. Heroes were Ajay Devgan and Aisha Takia, and she was drugged. This amphetamine was that way used in that way, party stimulant like that. It is in the form of methamphetamine, and she was drugged with malintentions, and because of that, maybe there was a euphoria for a long period, but she forgot. There was a whole day she skipped from her memory. That one day memory was totally lost. That was the side effect, or related to effect of that particular drug. I do not remember the name of that movie, but it was quite interesting movie. What can be the effect of the drug like that? So this is the drug. So these are the reasons behind this. These are the risk factor, like substance use. Even cocaine can do this, because it is also CNS stimulant. So many CNS stimulant which are actually consumed for euphoria, they will make problem in the sleep, and thus it will cause insomnia. There are many other things like shift workers, those who are having, because their circadian rhythm, many people have written nicely about it. We call it as circadian rhythm or diurnal cycle. They are changing, and because of that they feel difficulty in sleeping at normal time, because every week their sleeping schedule is changed. And therefore in old literature, or Indian ancient Ayurveda was telling to make a very clear routine, sleeping time, that too early sleeping, early to bed, early to rise, everything was there. This was actually having all this meaning, and that was resulting into activities, or nice activities, or less problems. Then people say that there are good links between various comorbid conditions, as we have seen stress or anxiety, which we shall be seeing later. Then even some psychiatric diseases, there can be a bidirectional one, means insomnia for long period can result into unmasking of or exacerbation of psychiatric diseases, and vice versa, that psychiatric diseases may cause insomnia, and in both cases they are increasing each other. So that is very difficult situation. That means one has to control both insomnia as well as psychiatric condition. And therefore, if you remember in earlier lectures, we have seen that in case of very strongly maniac cases, we have tried to give them sedatives so that they can sleep or their aggression can reduce. So these are various conditions. We can have various problems. Many people have breathing disorders, particularly it is called as sleep apnea. What happens during that is person is sleeping, and because of that the muscles get relaxed. We have seen those who have written about sleep. I have found that some of you have written that muscles get relaxed. So the smooth muscles get relaxed, so bronchial muscles get, and the pharyngeal muscles get relaxed. Because of that relaxation, they obstruct the respiration tract. This is why snoring is there, particularly it is more in the elder people, and this causes the difficulty in breathing. So there is a hypoxia, then hypoxia will result into stimulation. You might have seen, or if you can study at any time, we call it as a hypoxia mediated respiration or CNS stimulation, and that will cause again waking up. So the person will not able to go into deep sleep properly, and all the stages of sleep which is resembling natural sleep will not be there. So this is secondary. So insomnia can be, as we can say, it can be a primary. People say that it can be an idiopathic. Idiopathic means where we do not know any reason, or it can be secondary to anything. It can be secondary to maybe stress, to any kind of disease, or maybe psychiatric or cardiovascular or any other kind, or it may be because of sleep apnea or any other thing. So basically what we have to do is we have to go for treatment of the primary cause simultaneously when we are treating insomnia. So what are various disorder categories, what are various insomnias we can have? That is adjustments in acute insomnia, behavioral insomnia of the childhood, child doesn't sleep in time. Then psychophysiological insomnia, it may be stress induced or psychiatric disease induced. Paradoxical insomnia, for no reason there is there. Idiopathic, where we cannot identify cause. Inadequate sleep hygiene. Sleep hygiene is very, very important. I don't know, again, fortunately WhatsApp University we call it. It is giving very good knowledge, and you might have received this kind of WhatsApp, this course content from that what has to be done. Actually, and many time these people forward these messages at late evening or almost at night. So they say that what is the sleep hygiene, that you be relaxed. Most probably that was the reason when in older days in evening prayers and something were arranged so that mind gets relaxed, mind gets away from the stress factor, and people can sleep nicely. Nowadays people have forgot it. Now they are going for late night movies and something like that. So this is not a good sleep hygiene. It is inadequate sleep hygiene. People say that before sleeping you should not have any stressful situation, not on eyes, ears, and mind, etc. So that gives good sleep. And due to mental disorder we have seen, medical conditions we have seen, drug or substances we have seen, and not due to substance or known physiological conditions, and where we cannot identify it properly. Then organic insomnia, that means there is some problem in brain somewhere. We can say it is anatomical problem in brain that is affecting, and these are various situations which are resulting into insomnias. Then we can have breathing disorders also. Then hypersomnias of central origin. Hypersomnias means sleeping more than normal. Then circadian rhythm disorders, example of these are jet lag, etc. People are flying from this country to other country, and from one time zone to other time zone, and because of that, if they start in that way, then if you flow towards west region, then most probably you parallelly you reach in same time from where you have started, you can understand this. That means if you start somewhere in 7 evening, then by the time somebody reaches America, it can be almost same time or somewhat slightly change. So whole night actually it has become in this way. So this is how this is called as jet lags. So because of this kind of circadian rhythm disorders, or it can be because of shift duties we have seen. Then parasomnias, sleep related movement disorders. In sleep people walk, they talk like that. Then isolated symptoms which are not much specific, and some sleep disorders are there. So these are various categories of sleep disorders. We can have diagnosis of it, and we can have, just like we have got various scales, we can go for a scale. Now what kind of situation it is, it has to be checked. So go for sleep history and take following data. uh, what kind of thing is there, why there is a difficulty in falling asleep, or whether it is a difficulty in falling asleep or it is happening awakening in between, means they are sleeping timely but getting a wake up during in between, or poor or unrefreshing sleep. Why this can happen? Because you have gone through now the details about it. When sleep can be refreshing, when all the stages are perfectly reached in that particular time manner. If it is not there, particularly person do not go into deep sleep, then the sleep will be not refreshing one, it will not show any sign of refreshment. Then what is the onset of sleep, what is the duration of sleep, what is the frequency of sleep, what is the severity or depth of problem, and how it is, what are the factors which are affecting, then what is the past and current treatment, whether it was going on for any disease which is supposed to affect it, or which may have impact on that. What are the sleep wake schedule normally, at what time person goes to bed, what time, how much time person takes for getting asleep, what are the factors which prolonging sleep onset. Onset means from getting bed to getting sleep, this is the onset. Factors shortening the sleep, getting sleep and getting wake up early. What are the awakenings, how it is there, how many times people are waking up, number of times, what are the reason behind that, what kind of awakening is there, because of the dreaming, because of some other all of a sudden some stressful event, most probably in stressful condition it happens. And what are there, what are the reason there, what happens after that, means after once wake up in between, whether can go for sleep immediately or it takes time. Then what are the associated symptoms, what are the associated behavior patterns which are there. uh, what is final awakening versus time out of bed, again it is very important, you must be experienced, or at many places it must be there. People get up waking up somewhere maybe 7:30 and taking around half an hour to get down from the bed. So what it is, that means that it was not refreshing. What is the amount of sleep exactly obtained then? What were the nocturnal symptoms? As I told you, dreaming, etc. Whether any respiratory, as I told you, sleep apnea or sleep dyspnea, or snoring too much and affecting. Then whether there is a motor or other consequences, other medical consequences, behavioral and psychological consequences during night. What happens during daytime activities? If whether the person is feeling sleepy during daytime, whether it is because of fatigue or actually feeling sleepy. This means those who have not had a good sleep during night, they may feel sleepy. And somebody has written that daytime sleep is not good. Okay, only Ayurveda says maximum 20 minutes siesta, if at all somebody wants, not beyond that. And whether there is a napping is happening during work, is it because of the lifestyle related, whether the person has to travel along, and see the daytime consequences of all, that is quality of life. That means We have seen that if the person do not get, or if the person is deprived of the sleep, then cannot function on the work. So quality of life is changing, it is affected. If the person is not getting enough sleep, then its work is affected, its output is affected. There can be mood disturbances, there can be cognitive dysfunction, means we will not able to understand. Example, when I am asking question, only few can answer. So I feel that many times they might have not have good sleep because their cognitive domain is not there. I told you there are sequences of that. When I am speaking, your ears are capturing it, it goes to your that center from where you can recognize that there is some voice. Then it will go to that cognitive domain, that you will understand this is a voice, this voice is asking some question, and this question is related to this topic. This everything is cognition. Then you have got some association neuron that will take you to the portion of the memory from where you will try to reply it. Okay. So when this cognitive dysfunction is there, many do not even understand that it was a question, or they can answer it, or there is something memory they are having about it. So this is what a problem, particularly this may be because of the sleep deprivation. Then exacerbation of the comorbid conditions are there. We have seen that it can be cyclic one. We have just now seen that in psychotic diseases there can be problem, or there can be deprivation of sleep, and the deprivation of sleep can cause increase in the psychiatric diseases. So this is what they are helping each other, and this is we call it as a vicious cycle. So it has to be broken. So simultaneously antipsychotic treatment and sedatives to be given, so that these people will have normal sleep, and once they have normal sleep, then their what we can say exacerbations or the further effects will not be there. So go for that, you check all these things, this is what cycle is there. All these parameters are there which you are measuring on using various questionnaires, and on that basis you are coming to certain conclusions what kind of situation was there, and accordingly go for final assessment, whether what can be the reason, whether there are certain reasons which are causing this problem. And this type of basic information is based on various questionnaires. So there are various examples questionnaires which are used in baseline and treatment outcome assessment. Baseline means before treatment, and treatment outcome assessment means after certain period of treatment, to check whether the treatments are any outcome or not. So or the treatment are giving some good prognosis or not. So what are these example of these questionnaires or sleeping scale are there? Example of these are Epworth sleeping scale, that is it. This Epworth sleeping scale, that is ESS, is an 8-atom self-report questionnaire used to assess the subjective sleepiness. Score ranges from 0 to 24. The normal person will have it less than 10, and if it goes more than 10, that will indicates that there is a mild, moderate or severe insomnia. Then ISI, that is insomnia severity index. ISI is a Pakistani team. So it is a 7-item rating used to assess the patient's perception about insomnia. Then Pittsburgh sleep quality index, this is 24 item. These are 24 items, means 24 major items are there, in that sub questions can be there, and it measures the sleep quality. Poor sleep will have global score greater than 5, then it indicates that the sleep is poor. Global means these are 24 item, and there are many sub quantum. So overall if we will measure, global means I repeat, we have discussed it earlier also. Then Beck depression inventory, we have seen BDI earlier during depression also. This is 21 atom self-report inventory that is used to measure depression, minimal or no depression, and in that impact of insomnia will be coming. Then state trait anxiety inventory from Wyatt trait scale. This is a 20-atom self-report inventory used to measure anxiety. If you remember now, whenever we say that self-report means These are patient reporting. If you remember that two types of scale we have seen earlier in schizophrenia, depression. In depression, there were two types of scale. Some were done by patient themselves and some were done by clinicians. And in schizophrenia, all were done by clinicians. Here, almost all are done by patients, because this is not very severe condition like schizophrenia. So it is self-report inventory that is used to measure. तीन ते चार एक आणि 4 ते 5 एक आहे. हो. Then this is 20 atom, that is state trait, and that measures that is score range is 20 to 80. Minimum anxiety, here again it is linked with the anxiety. I told you anxiety can also cause, or it can also affect sleep, or we can call it as stress related. T score is if it is less than 50, and significant anxiety where T score is greater than 70. So then fatigue severity scale, it is 9 atom patient rating of daytime fatigue. The people who are not having good nighttime sleep, they will experience more fatigue like situation, or may not be exactly, but at least their psychological feeling will be like that. Short term form health survey, that is SF36, it is 36 atom self report inventory that will check generically measure quality of life for any disorder. It will be range from 0, that is poorest, to 100, that is the normal or well sleep. Dysfunctional beliefs and attitudes about sleep questionnaire, it is a self rating of 28 statements that is used to assess negative cognition about the sleep. So these are various sleep related tests, and it has to be checked what are the situation, what are the reasons. And again, once you get all this data, then go for the differential diagnosis on the basis of what can be the reasons, what can be the comorbid factors, and accordingly go for that, make suitable plan so that you can go for that particular disease. As I told you, primary treatment for the second, if the insomnia is secondary, then go for the treatment of primary cause of it. And if it is the primary insomnia is there, then you check out whether it is psychophysiological or it is idiopathic or paradoxical insomnia, and then accordingly go for this insomnia. For this, what kind of treatment you accordingly we can go for treatment. So we can accordingly treatments can be started. Goals of the treatment simple is to improve the sleep quality, depending on what is actually affecting, whether it is onset is affecting, or in the mid the waking up is there, or it is incomplete sleep is there. So check out what are there, and accordingly go for that. Check out with the genetic relations about it. This some of the fetal familial insomnias can be there. It is a rare disorder, no specific genetic association have been identified, but it is a familial tendency for insomnia has been observed, and the relative contribution of genetic trait vulnerability has not been so far found, but it has been found that in whole family people are not able to sleep properly, and then it can be fatal, means it can result to mortality, because we have seen that if the inadequate sleep is there, it can result for so many complications, so many health complications. So general consideration and treatment goal is what, that is we want to have, we shall see various tables which are given with this, in that to reduce the reduction of sleep, that is we have to whatsoever sleep is there, we have to make it, the symptoms has to be improved. There is improvement in the daytime function, reduction of the distress because of the insomnia. Treated outcome can be monitored longitudinally with clinical evaluation. We have seen that outcome we are measuring either one for diagnosis or baseline information, and then again we have got questionnaires for the further improvement with the treatment. So go for clinical evaluations, questionnaires, and make the sleep logs, that you can give the just like those many time doctors give patients to particular hypertension patients or diabetic patient to monitor their blood pressure or diabetes and make a chart and try to maintain it and try to put the remarks in what condition it was increased, in what condition it was decreased. That helps clinicians to make the decision in better way. So similarly, we can ask the patient that to go for sleep logs, that is previous day at what time they sleep, how was the sleep, whether sleep was sound or not, what if there were disturbances, what were disturbances, what kind of disturbances, and how much sleep was there. So whatsoever information can be there, we can give one tabular, one can format from in which it can be there. Then quantify the sleep quality, daytime function improvement in comorbid condition requires more involved assessment, often specific questionnaires for specific insomnias. So we have got again tables for that. And then go for various treatments, particularly we can have benzodiazepine receptor agonist. They have short-term efficacy for the treatment of chronic insomnia, and many other drugs we can use for. So before going for treatment with pharmacological one, again we have got very popular one in this whole chapter. We call it as a cognitive behavioral therapy or behavioral therapies, or we can call it as a counselings and guiding about sleep hygienes. As I told you in WhatsApp University, I have read it many times that before sleeping, do not read anything stressful, do not see any movie which is stressful, minimum or minimize your auditory and visual this one visual stimulation. So if somebody is seeing so many maybe it be mobile or TV or computer whatsoever, so try to reduce the light which is falling on eye or hearing or smell, like that. So all, because all this stimulation anyway are going to brain, and brain has to make it, categorize it कि ये क्या हो रहा है, ये मूवी आ रही है, बहुत अच्छी मारधाड़ आ रही है, या बहुत इमोशनल सीरियल आ रही है. So every time brain has to work, and if brain works, then many time brain may even forget that it has to sleep. So that, because that training, so that is what sleep hygiene is there. So one has to inculcate that sleep habit, go for this sleep hygiene, go for better ambience, reduce the light. Many things are there for sleep hygiene. So this has to be done, and accordingly one can go for better sleep. Now let us see one by one what are the this situation in graphical form. So consider behaviorally induced insufficient sleep if there is insomnia. Before that, complaint of difficulty of falling asleep, difficulty in maintaining sleep, or there is a non-restorative, or we have seen again, you people have wrote so many about sleep. So sleep is restorative, because whatsoever work has been done or whatsoever muscles and all were active throughout the day, we are giving them chance, to repair themselves, to give them some chance to make the changes which are essential for their better functioning. So this restorative sleep is not there. Then adequate opportunity and circumstances for sleep are available or not available. If they are not available, then make them. That is what it makes the portion of it sleep hygiene, that ask them to have a less lit room where less auditory or visual stimuli are there, where less other discussion or something is going on. So this is what adequate opportunity and circumstances for sleep are to be given. And consider the behaviorally induced insufficient sleep. Consider it as a behaviorally induced insufficient sleep, and then accordingly, if it is okay, continue it. Now there are two things again. Waking symptoms are there, means sleep is normal, person goes to sleep but in between gets wake up, and therefore have fatigue, lethargy, concentration, attention, memory, mood, psychometric, physical type of all these symptoms are there because of that. Now if they are yes, then what we shall do, and if they are no, then consider for a short sleeper, that is give them again both kind of things. I remember again for such condition when we were young, we were student. At that time, we were using that time. Uh, Many these books like Goodman Gilman were not. They were only one in college, and you are fortunate that you will get it as a soft copy. Even our days, there were no chance of having soft copies. Almost 30-35 years back. So at that time, the most popular book which from Indian author was Satoskar and Bhandarkar. And in Satoskar and Bhandarkar, I remember very nice quotes were there that allow these people, or at least give them, it was sort of prescription, that a glass full of milk. Why? Because it contains tryptophan, which is converted into 5-hydroxytryptamine, and this 5-hydroxytryptamine plays very important role in sleep. So again, those who understand, those who can think about it, it was what Ayurveda was there. Unfortunately, nowadays people drink something else, which may not allow them to sleep early. And as I told you, at many places people rather want to unnecessarily wake up with amphetamine or methamphetamine or cocaine because they feel good. So in that condition, that is another story. But anyway, so this is, we can have such kind of agents when these things are there, so that tryptophan can be increased. Then if these are all problems are there, wakings and all other things are there, then check out again whether there are abnormal pattern of sleep timing are there. Means sometime, because maybe shift related or maybe travel related, whatsoever it may be. So patterns are sometimes sleeping early, sometimes sleeping late, sometimes waking up early, sometimes waking up late. Then if it is yes, then consider circadian rhythm sleep disorder, because we'll call it as circadian rhythm. This is because of the jet lag, or because of what I told you, shift duties. So here the circadian rhythm is not proper. But if it is not the case, then we'll go for the further assessment that it is childhood onset was there, or many other factors were there. We shall see them. What are these? Okay, for each cases we have to go for the next again. Then so we have finalized either there is a abnormal sleep timing are there, and we have finalized this. Yes, it is there. We have seen the reason. It is what? It may be shift duties or jet lag, or maybe some type of work it is there, sometimes sleeping early, sleeping late. So it is a circadian rhythm disorder. Then uh, then the problem is restless legs symptoms, that is legs are continuously moving, particularly during sleeping, snoring. Then these other symptoms, then abnormal sleep movements, daytime sleepiness. If it is yes, then we'll consider it as a restless syndrome or periodic limb movements disorder, or we can call it as sleep related breathing disorder, or we call it as a parasomnia. So these are various things we can think about, and accordingly we'll go for the treatment for that. But if it is also not there, then what is to be done? This is the subsequent we shall see. Then medication substances which are temporarily related to insomnia. If yes, then we'll call it as a due to drug, substance or alcohol. They are causing it. So it may be cocaine, it may be amphetamine, it may be any other stimulant. Many are having habit to drink tea or coffee in the evening, which is containing caffeine, which is CNS stimulant, and it will not allow. So anything, drug, substance or anything which is affecting sleep, then will insomnia due to drug substance. So now what we are doing is we are categorizing it. We are categorizing them into what? We started with behaviorally induced insufficient sleep. This was the first one. Sorry, we have started. Yes, we have started with first categorization we have made. It was the simplest form, behaviorally induced. Then we went for this short sleeper. Then we are having another categories one by one. Then we are having medication related. Third one is medical disorder, maybe depression, maybe schizophrenia, maybe psychotic disorder, or maybe respiratory or any other disorder. If it is yes, then insomnia due to medical condition. Then psychiatric we are classifying separately. Psychiatric disorder, temporarily related, then consider insomnia due to mental disorder. Now if this already we have categorized, if not there, then we have another further assessment. So check out for childhood onset and no precipitant, nothing, it is not precipitated by something. If it is yes, then we'll call it as a idiopathic insomnia. Then if it is because of the marked subjective or objective mismatch, extreme sleep symptoms are there, we'll call it as a paradoxical insomnia, sometimes too much sleepy, sometimes not at all sleepy. So it is a paradoxical this one. Behavior and practice which is incompatible with the good sleep, so we'll call it as an inadequate sleep hygiene. As I told you, behavioral patterns are there. Then presence of acute environmental or physical or social stress, then we'll call it as an adjustment there. Example, मेरा बेड चेंज हो गया, नींद नहीं आती, मेरा गाँव चेंज हो गया, नींद नहीं आती, है ना, चद्दर चेंज हो गई, नींद नहीं आती. I have seen so many such, or I have come across. So presence of acute environmental, physical or social stress. So in that cases, this is adjustment insomnia. Then conditions, arousal, learned sleep preventing associations. So we call it as a psychophysiological insomnia. And all these are once if they are no in that, then last one we call it as a unspecified insomnia. So this is how we have now went for diagnosis of insomnia, that how we can diagnose insomnia. And once we fix the category of insomnia, that will be easy for treatment. I hope you understood this. You can go through again, and I appreciate again, and please keep this kind of trend of remaining prepared for the things. So next chapters in psychiatric you must be knowing. Let me tell you, it can be obsessive compulsive diseases. You can go through it in next few days. And another is anxiety and panic disorders. So immediately after this we'll go for anxiety and panic disorder, and then we'll go for OCD. So in the meanwhile, this is again go for this anxiety. What are the drugs which are available for anxiety? And second thing is, what do you mean by anxiety? What are the consequences? Again, please go through this and please submit it. Okay, and immediately after that, when you get time, you may, these two assignments are there. First we'll complete anxiety, and then we'll go for all anxiety disorders, and then we'll go for the next one, that is OCDs, obsessive compulsive diseases. Okay. Most probably sessionals are being planned. We'll go for sessional accordingly. If you can make questions, that will be fine. And if you have any difficulties, we can have a session after once we finish this one, this psychiatric topic. Please go through it. Please read various guidelines. You can search them nicely. If you have any difficulty, again we can have a small session over that, how to have this searching on that. Okay, so take care, be safe, and go keep on studying. All the best.
Sir, how are the sessions going to be conducted?
Online. Acha, Mansi, one more thing I forgot, I'm sorry. Now see, what has been happened is, in other cases in B Pharma particularly, they have got mentors who continue. Suppose they start with the first year and they end up till final year. In case of PharmD, the change has been made in such a way that the mentors are fixed for the classes. Example, Mahaprabhu sir will be mentor for always first year and second year. Then Shamkor sir will be mentor for the third year and fifth year. And I shall be mentor for fourth year and sixth year.
Okay, sir.
So in that context, whenever mentor related meeting we can have this mentor meeting. Maybe we may involve parents also sometime. And second thing, as a mentor, now we are submitting the data. We want to know that subject wise how much syllabus is covered, who is a subject teacher. If you can submit it maybe by Monday morning, that what subject are being started. If any subject is not started, you can put it like that, it has not started yet, or 0%. And if teacher is known to you, fine. If it is not, then you can tell that it is not yet assigned, or we do not know about teacher. So these are what are the subjects, how much syllabus is over, compare with your syllabus, how many topics are over, and just submit it to me, just send it to me. Before that, you take opinion from all the students. Okay, means whether they are agree or not. It should not happen that Particularly this happens when uh, those who are asked for maintaining attendance, they are attending it more or less than average attendance. If the average attendance people we take, and if somebody is attending more, much more, and somebody is attending much less, suppose Mansi is your CR and Mansi is attending much more than other, then she may tell that ye ho gaya, and others are not knowing about it. Or vice versa, if Mansi is a CR and she is not attending the classes, then people must be knowing, and she will write that ye nahi hua. I hope you understood. So take opinion of everybody, finalize it, and just put it on our group that this is over like this. So okay. And again, difficulty wise, whenever you feel, you please mentor wise, if it is other subject related, it is there, and if it is subject related, you can put it on therapeutics group. Okay.
Okay, sir.
Any other problem, you can just report to it to me on our group, so that I'll be able to or I'll understand it and try to take some measures against it. Okay. Thank you.
Okay.
And I'm very happy, I repeat, I'm very happy you people are responding well. So keep on responding, and we'll have good interactions after that. Okay. Thank you.